Hey, good morning, y'all. So, it's been a minute, and this morning we're going to do personality disorder, OCD. This is personality disorder that's near and dear to my heart, and it's actually kind of in my family, starting with my grandmother. My grandmother had OCD in a way that most people don't think. Most people think of OCD and they misuse it, and they describe it as people that like things super clean and organized. But if you've actually had the condition of OCD, it's a little different. OCD doesn't happen all at once. Symptoms usually start, and they can seem like normal behaviors, but and they can be triggered by personal crisis, abuse, or something negative that affects them a lot, like a death of a loved one or a terminal sickness. If your family have OCD or another mental health disorder such as depression or anxiety, that kind of pulls in and triggers it together. There's a lot of people in my family that seem to have anxiety disorders, and you'll find that a lot of times they come down from their hereditary. They come down the hereditary line. So some of the things that we see when we see OCD, which is obsessive compulsive disorder, stress seems to up it. So when they're stressed out or worried or concerned about something, they get started on trying to do things. Mine was my grandmother. Every year at Christmas, she would give everybody in the family $10. All of her grandchildren, all of her children, $10 for their birthdays, for Christmas, and for anniversaries. And so what she would do was she would put them in envelopes, and she would over and over and over pull them out and count them to make sure they were there. She was freaked out about possibly thinking that somebody wouldn't get their $10. That meant the world to her. So she would just go crazy with counting over and over, obsessively counting the money. She would lose things. She would pull things down and count them, be it medications. She would just fixate on things. A lot of times they have a theme, a common obsession with people with OCD is a fear of germs or dirt. So they wash their hands multiple times. You might be scared to touch things other people have touched, like doorknobs, or you don't want to hug or shake hands with people. That's why they elbow or fist bump. And I think that with 2020 and the things that we have that came about, I think that it's really gotten worse. Like I think that there has been a fear infused over through the medical field on this theme. There's also a theme or a fear of hurting yourself or someone else. So when you're thinking of something completely different, you have thoughts about hurting yourself or someone else. This can be obsessive, constantly thinking the worst case scenario, horrible things, expecting the worst. Excessive doubt or fear of making a mistake continuously. So these people, you might need constant encouragement or reassurance from others that you're doing okay or what is right. And sometimes this is brought in, I feel like, in a relative to your growth as a child, when they're constantly shamed, or they can never amount to the standards of what a parental figure has for them. So they're constantly wanting to know if they're doing okay. Are they doing okay? Is everything all right? So forth and so on. Then there's also a fear of being embarrassed. So with that fear of being embarrassed, you're afraid you might yell out or curse words in public or behave badly in social situations. So they become panic driven inside. That is one of the things for OCD. Another one is fear of evil or hostile thoughts, including warped ideas about sex or religion or even politics today, right? Politics have really taken over a lot of people. You imagine troubling sexual disrespectful scenarios. So these things are just examples of obsessive compulsive. I think the biggest one is there's some people that they will go and they'll check the door. They'll make sure it's locked 3 times, and they'll count to 3. 1, 2, 3. Different things. They'll check everything, and they'll check it, and there'll be a number. They'll be obsessed with the number. How many times? 1, 2, 3. 1, 2, 3. Everything will be done. And they may say it in their head. They may say it out loud. They may talk to themselves. They may talk out loud. They may, just to make sure that they are getting it. There's such a heightened sense of fear with OCD. The other theme is washing or cleaning. Like obsessions, compulsions also have common themes and symptoms. So common compulsions is washing or cleaning. You wash your hands, you shower or take a bath over and over and over. Nothing's ever clean enough. You're trying to get everything off of you. Checking. That's what I just was talking about. You check repeatedly to make sure the kitchen appliances are turned off or that the door is locked when you leave. You keep checking it. That's a common theme with OCD. Counting. That's my grandma. She was counting. You say numbers in certain patterns out loud to yourself, counting the money over and over and over every day up until Christmas, multiple times a day, making sure and panicking that one person's name might not have a $10 bill in there. That fear, that was hers. Order. You feel you need to eat certain foods in a specific order. You arrange all your clothes or kitchen pantry items in a specific way. Everything's got to be organized in a certain way. And people will freak out if things aren't in place. If somebody moves a towel or whatever, they'll go over and have to readjust it. It's really upsetting to them. And it's not something that we joke about. It's a serious situation for them. And so we want to make sure that we're not joking about these things. Another thing would be routine. You say or do things at a set number of times in a certain way before being able to leave the house. So you're frantic. You're checking everything over and over and over again. Collecting or hoarding. A lot of these people are hoarders. Your home is full of things you don't use or need, and you can't stop yourself from buying more. I remember when my grandmother passed, I think my aunt found over 40 Arid deodorant containers, and it was a specific, I think the store even ordered that deodorant in multiple bulk just for my grandma, like was a cream that you put, and we found tons of that stocked up. So they stock up on a lot of things. I know that I had a past a previous husband that he would store up. He would buy in bulk multiple of the same items. Every time he bought 3 or 4 of the same item to make sure he had enough. These repetitive routines usually don't have anything to do with the obsession you're trying to fix and can take hours to do. So it occupies their time. It over occupies their time. If you think you might have OCD, you could see a doctor or psychiatrist. They do a physical exam. They do blood tests to check your blood count, how well your thyroid works, because thyroid could have a problem, and any drugs or alcohol in your system, because there's a lot of things that are drug-induced schizophrenia, drug-induced OCD, anxiety, paranoia. There's so many things that are drug-induced. Many people have superstitions or rituals or a fear that they have left the door unlocked or even the oven on before leaving work or for vacation. If you can control those thoughts or think about them logically, it's probably not OCD. But if you can't control them and they take up at least an hour of your day and cause problems in your life, it's a sign to probably try and get help. It's probably a sign that you need to get help. And again, I say don't bully or talk down or cut jokes about people with this. This is a serious situation for them. It's serious. Getting them help or finding talk therapy or something in that nature to help them is probably the best thing you could ever do. I pray this helps somebody today, and I pray that you go forth and be a light. Bye-bye.